Hi, my name is Aston Morgan, and I am with Black Health Matters. And this is the Driving Equity in Communities of Color session. Driving racial equity means supporting communities of color in their journeys, exploring racial equity, power, and trust. One major way that we can do this is to take a look into our medical and healthcare systems and ensure quality and expert treatment for all individuals. Please join me in welcoming our panel, Reverend Dr. Terrace A. King, Dr. Philip Fairweather, Dr. Laura Lee Hall, Kristen Stephen Hobbs, MPH, and Helen Ortega, MPH. Thank you.
So I guess I will get us started. I'm going to share my screen because I have a few introductory slides. Can you see it? Is everyone good?
Yes, we can see it.
Thank you. So you see that our title of our session is Driving Equity in Communities of Color. I want to thank some people for today. Our fantastic panel. So we have really representatives from the executive suite in a health system, Helen Ortega, a clinician leader, Philip Fairweather, a public health leader, Kristen Hobbs, and a pastor, community leader, and also health expert, Reverend Dr. Terrace King. I want to thank Black Health Matters. I want to thank the CDC for support for this session and Sanofi Pasteur, who supports a lot of our vaccine advocacy and education, and especially you all who are here on a Saturday learning and empowering yourselves to make a difference. A little bit about us. Dr. Gary Puckrin founded the National Minority Quality Forum more than 20 years ago and is the president and CEO. It's really one of the major health equity voices, education, advocacy, research in the nation. I am the president of the Center for Sustainable Healthcare Quality and Equity within NMQF. And our goal is to apply the tools of education, engagement, and training for clinicians and community leaders to promote sustainable, healthy communities in every zip code. So we're going to focus a lot today on flu and COVID vaccination, and just a brief reminder of why we should care about this. So this is just some data going up to November 1st, and you can see that Black Americans have the lowest rate of COVID-19 vaccination. They also have among the lowest rates for flu vaccination going back over 10 years. And that has consequences. Some people don't appreciate the risk that flu can present. But if we look at non-Hispanic Black populations, they're almost 2 times more likely to go to the hospital or to the ICU because of flu over the last 10 years. Our own research, I just will briefly mention, took a deep dive into the U.S. Medicare beneficiary files. And for people of color, and especially Blacks, and especially Black women, there is really the lowest rate of flu vaccination. There's a daunting disparity. And our analyses really showed, published here in Lancet, that you can't explain it except by the fact of a person's skin color. So obviously we have work to do. I want to just refer you to a couple of tools because everyone here can make a difference in terms of promoting equity and in promoting flu and COVID vaccine equity. It's the DRIVE toolkit, so that's why we call a lot of our sessions driving. And it really provides as many resources for clinicians and community leaders to implement activities that can promote equity. I'm just showing you this little news blurb one of our participants at a federally qualified health center in Richmond, Virginia, were able to work with us and use this toolkit and achieve 20% increase in flu vaccinations in the height of the COVID pandemic. It's not just a health system toolkit. Individuals, health champions, our CoLab members that Kristen has founded, various health system members, including pharmacists, and community leaders like Reverend King, and barbers and stylists. We have resources for all of these kinds of individuals, and I'd urge you to take advantage of them. Here's where you can find out more, but let me turn this over to the conversation with our distinguished guest. And I really just posed 2 questions to them to answer today. The first question being, how have you promoted health in communities of color through influenza and COVID vaccination in the last year or so? I wanted to start out with the positive stories they can share about making a difference so you can be inspired and learn how to do so in your own community. And then also to follow up with the second question, what do we need to move forward and continue this health promotion equitably, including in flu and COVID vaccination? So I'm going to stop sharing and invite each panelist to answer the first question first, and then we'll go to the second question. They each have about 3 minutes because we want to give time for you to put questions in the Q&A box that we will address at the end of our discussion. So I'm just going to go in alphabetical order. That means I'm going to start with Helen Artiega, our Chief Executive of the Elmhurst Hospital in Queens, New York. So tell us, Helen, about what you have done from your perspective, where you sit, to promote flu and COVID vaccination.
So first, good afternoon, everybody. Happy Saturday. Thank you so much for doing this, and thank you for joining this session. I think one of the major things as a healthcare leader that we've done to really help our community really focus on making sure they get vaccinated for the flu and COVID is really setting the policies, setting the programs and the process flow to make sure that is accessible and easy to do. One of the things that, sadly, many of the programs that, we try to do and that we make it difficult for our communities. It says, can you put yourself in the spotlight? I don't know what that means. Do I click on something?
I'm sorry. I was hoping that one of our colleagues at Black Health Matters could do
so. There it goes. Someone did a magic.
Thank you. Sorry to interrupt your flow.
That's okay. So one of the things that we made sure that we did at Elmhurst Hospital is that we wanted to make sure that to have the flu vaccine and have the COVID vaccine, we wanted to make sure that it was accessible. We all know the data that most Black and Latino communities, access is a big issue. So as a healthcare leader, one of the things that we made sure that we did, is not reinvent the wheel. So perfect example, the toolkit that Laura Lee was mentioning, we actually looked at that and said, okay, what are some best practices that already are proven out there to increase access? So the second thing we did is how do we reduce the paperwork? How do we make sure our patients come in and not give them 10 pieces of paper to fill out so they can have access to the flu vaccine? And then the third thing we did is making sure that we had the correct staff there. We wanted to make sure that the staff that was there was culturally competent and at the same time clinically competent. And then we also wanted to make sure linguistically they were competent as well, because at Elmhurst Hospital, we speak over 125 different languages, which represents anywhere from 90 to 93 different cultures and religions. So for us, that was really important. Setting the policies and the process flow in place was, I think, an important key for our success. Currently, right now, Elmhurst Hospital we're giving out flu vaccines for everyone in the community for free. And we're also giving the COVID vaccine plus boosters, and now children over the age of 5. So far that I'm so happy to report that we have given 100,000 vaccine as of yesterday. And I think and it begins with looking at process, looking at best practices, and really not reinventing the wheel.
That's fantastic, Helen. I know your passionate leadership has made such a big difference here. Um, so, Dr. Fairweather, you are a clinician, physician. Maybe you can share with us, as we put you in the spotlight, how you have been able to promote vaccination of your patients.
Thank you for this invitation. It's really an honor to be here, and I absolutely think this is an amazing opportunity for us to really connect with our communities. This is certainly an efficient way. I know, though, that it feels that, you know, when I think of the engagements that I've had with my patients over the past several months around the issues about vaccination, it is probably the most impactful time is when I'm able to sit in front of them and answer their questions and be very, you know, direct with the answers and have that sort of, you know, exchange, because I think that ultimately, you know, we are at that place right now where the folks who want to be vaccinated, who understand the science, who are committed to the science, are vaccinated. We are really in and struggle now with the folks who, and have the challenge really of those people who are concerned, and very many of them have very little legitimate concerns that we have to respect. Unfortunately, we do struggle with, you know, social media and the information that people are sort of gathering or hearing, and may not really fully trust the science and the science that we are using to sort of guide us to sort of make these recommendations. I cannot resist, as an emergency medicine physician, though, having been at Elmhurst for as long as I have, and worked in the emergency department working in the emergency department last March, not share with you the real challenge that me and my colleagues had to face. And, you know, it is honestly what drives me personally. I think what drives my community of clinicians here at this hospital, that drives Ms. Arteaga, because I think that experience was so profound. You know, we were the epicenter, and I think clearly our Black and Brown community is the epicenter of the epicenter when we look back on the numbers of people who have been infected. At this point, it's 47 million cases of COVID in this country. So to date, over 760,000 deaths, and a disproportionate number of them are within our communities. They're in the Black and, you know, and Brown communities. So there can't be a more important issue to address. And I think it's clear from our evaluation of the situation, Elmhurst sort of was in a place where it was sort of a circumstance that was a perfect storm. Large immigrant population, as Ms. Arteaga has mentioned, you know, multi-generational homes, close living quarters, you know, people without the sort of resources and access or ability to to self-isolate or to work from home. Those were all issues that were just really bore down on us in particular. And as this pandemic raged, we saw the impact of that, you know, quite immediately. What I think is sort of an unexpected development is in my mind at least, the reality that we now have a vaccination as an opportunity to prevent this infection, to really get ahead of this and the challenges that we are facing, and the information or the circumstances that are undermining this effort are so, in my mind, it's still unexpected. And the information sources are such that it really makes it a challenge to kind of figure out where and how to sort of go after this and address them. I think ultimately we have to be very flexible, and I think each community will have a different set of issues or a different set of strategies. We have to have more different strategies for each location, and I do think it is sort of at that level. My conversations, Ms. Arteaga and I actually spent a fair amount of time together at town hall meetings. We, of course, had a mandate in in New York State to have all healthcare workers vaccinated by the end of October. And we were met with the reality that there were still hundreds of people within our hospital community, the hospital that has had to deal with COVID the most directly and the earliest it feels in this pandemic. And even here, we were struggling with having and engaging people and convincing them that vaccines were essential. Hard to imagine that we should have. I really often thought that we would be at the forefront. All of our patients, all of our employees would be immediately sort of, takers of the vaccine, and not so. But I think what is clear, a couple of things are true, of course. I think, our employees, our colleagues in the hospital realized that there was, they needed the jobs. Of course, that was sort of the imperative. But I think that spending the time we did with our colleagues, answering those questions, really being sort of standing in front of and Ms. Arteaga could support this. There were, every meeting we had was very, very strong. There were very strong opinions with really well-articulated positions that, though maybe misinformed, clearly people felt strongly that this option, the vaccine requirement, was something that they really felt concerned about. And we heard multiple various issues, and I think we addressed them, and we did address them respectfully and patiently. So I think that it is clear that one of the key areas of sort of advancing this effort will require that we are patient, that we really spend the time that people need to understand the importance of this. Also, I think within these groups, there are people, and we found there were people who had actually been vaccinated and who could support the positions that we were trying to sort of talk and explain to folks. And the first thing, of course, is being the example, being the people. None of us were sitting in front of these audiences and saying we were not vaccinated. We just want you to be vaccinated. We have to really start with, I am with you in this. I am vaccinated. If you're concerned, your concerns are concerns that I've had to, consider myself. But given the circumstance, if there were to be issues that we are unaware of, these are things that we're, going to have to tackle together, because we understand that this is a circumstance, this condition, this scourge is one that requires all of us to be sort of mobilized together. And
I have to interrupt you here because you dropped so many pearls on our ears. I'm being asked to start my video. Sorry about that. I heard you start out saying that, you've got to talk with your patients. Yes. The team has to talk with your patients. I heard you say how the severe impact of COVID in your community early on did motivate a lot of people to be open to vaccination and even flu vaccination, yes. But that your staff, they too have had questions and concerns, even as they've been stressed. And again, you came back to the issue of communicating well with them. I kind of want to bring it now to Ms. Kristen Hobbs to talk about some of the strategies and successes she's realized as a public health leader.
Yes, thank you, Laura Lee. I definitely appreciate being here. So thank you, Black Health Matters, for the invitation. I think the first thing is meeting people where they are. We have to understand that Black and Brown communities are not a monolith. And so everyone will have their different opinions and different sets of experiences that they bring to the table, but also similarities. And those similarities begin with mistrust. The mistrust that Black and Brown communities experienced and still harbor are not invalid. They're evidence-based. As someone already mentioned in the chat, we don't have to look to the far distant past to see evidence of why that mistrust has been perpetuated. We see racism in healthcare as it exists today. And so the onus is not on communities of color to dispel that mistrust and fix it. It's the onus is on us as public health professionals, medical professionals, and scientists to do that. And so what we've done at NMQF and SHC over the last year, nearly year and a half, is really using appropriate communications that are led by health equity to reach communities of color in ways that are culturally appropriate and culturally relevant, but also culturally responsive to their needs. And we've also been building an ecosystem of champions. We have, Laura Lee talked about the Champion Collab that we started. We also have champions among our faith health leaders. Reverend Terrace is one of those wonderful champions. We have champions in barbers and stylists. We have champions in pharmacists. And so we really need to continue to reach people where they are by partnering with community leaders and other health champions who already know how to reach the people that still probably aren't buying what we're selling, right? And in order to move this forward, I think empowering Black and Brown communities to have the authority to lead the charge and to lead public health leaders, medical leaders, and scientists within these interventions is going to make the biggest difference. I know that it's cliche, but we always say nothing that's for us should be without us. Everything for us must be by us.
Thank you so much, Kristen. And I want to kind of end this part of the discussion with the amazing Reverend Dr. King. So Terrace, would you share some of your perspectives about what works, what you've done, and where we should go? We only have, I'm going to do a time check. I think we only have 10 minutes left. So I'll give you the closing moments to talk, and then we have quite a few Q&A.
So you're going to get to the preacher, then you're going to do the time check. Boy, I tell you, Lord,
alphabetical.
Right.
Alphabetical.
That just ain't right. But let me say something real quick here. I'll do a sermonette. Let me just give the context of Baltimore as to what we found. We, unlike the clinicians that have already spoken, we found ourselves in a city where racism was rampant. Baltimore City is the city of Henrietta Lacks. And the issues that we had in the African-American community in terms of racism and distrust and fear of the healthcare system are not historical. They are right now. And so that's what I faced stepping into that. And so what was my charge? My charge was really with the support of the National Minority Quality Forum to really use as a guidepost for me the words of Dr. Martin Luther King from a Birmingham jail. I had to talk to religious leaders across Baltimore about our interrelatedness, about our mutuality. I had to talk to rabbis, the Nation of Islam, mega churches, and community-based churches about our being tied in a single garment of destiny. That's really what happened. I had to say, look, we got to put all competitiveness and differences aside. People are dying. They don't trust them, but they trust us. Because before they ever knew anything about COVID, we were feeding them, clothing them, helping them to survive, literally, where food deserts are all across the city. So that's what I faced going into this. So what I did was bring a network together. Our governor had an access and equity issue in Baltimore. Black people couldn't get to the vaccine. They could not get to the vaccine because the vaccine was only in communities where white people were. Let me just say what happened in Baltimore. It wasn't a pretty picture. So across Baltimore, I put up a concept among churches called the 7 last words. Some Black people know what I'm talking about. I said, what we're going to do, we're going to take 7 churches and we're going to have a host church come together. And we're going to work together, and we're going to forget what size your congregation or budget is, because you can't get in your church right now anyway, because you shut down. So until you work with me, you will not get your doors back open. And they listened. And out of 500 churches, as they came together, we gave over 75 pop-ups, and we ended the access and equity issue. We were also able to raise the flu vaccine rate by 13%. Why? Because we came together in a network of mutuality. Tomorrow, Laura Lee, because of you, indoors masked, over 100 partners are going to gather in this building. Why? We are celebrating what we have done in Baltimore. And the network we have, we're not giving up on it. This is a semi-permanent vaccine site right now in Baltimore City. Every other week, we open up for all vaccines in Baltimore City, whether it's flu, whether it's shingles, whether it's COVID, right here. We are not giving the preventive health policies and practices of Baltimore back to the healthcare system. We are not going to do that.
That is so amazing. What a great sermonette. We only have a few.
You know, I was ready for more. But go
I
ahead.
know. And we can maybe put all our faces up for everyone to see. Let's give a few of these questions out to you all. There's some questions about are Black people more susceptible to COVID and flu? Anybody want to take that on? I don't know, Dr. Fairweather, if you want to.
So there isn't a greater susceptibility per se. There is, though, a clear risk that exceeds, the general population. So what we've come to understand is that there are certain risk profiles that unfortunately Black and brown people inhabit that when become infected are at higher risks of having severe disease, hospitalization, and death. And those health issues are hypertension and diabetes and chronic lung disease and chronic kidney disease, obesity. Those are things that we are clearly, and again, the fact that those elements of health issues are so endemic in our communities is its own set of issues. But layer on that, this disease that is clearly opportunistic and clearly driven and sort of embeds in our community, in people who are at higher risks in having these illnesses, it puts us at much higher rates and having us not, do well. So, we also may not have and don't have as often the opportunity to sort of, we live in maybe in more, in homes that have more people, multi-generational, where, infections can spread among us. But, that we are more infected or more likely to be infected, certainly the circumstances are such, our social circumstances might be, but not that we're going to catch it because someone else, more because of not Blacks or Black or brown people more than whites per se.
Helen, do I see you wanting to say something? I don't mean to put you on the spot. I just thought that you maybe want to follow up on the chronic conditions, the social environments people who have less means have, being more in the essential worker category, that's more exposed.
No, and I totally agree with Dr. Fairweather. It's not so much of, of being Black or brown. I think it's more of the situations we live in. I think one of the things that I think as coming from a community of color that I find always very interesting is that people are surprised by social determinants. This is work that we already kind of knew it's kind of sad to see our, world leaders at a federal level, all of a sudden see social determinants when they say, oh, well, COVID has exposed social determinants. No, social determinants was always here. People of brown and Black communities, we have the highest rates of diabetes, the higher rates of heart disease, actually the higher rates of being infected with the flu. So prevention is key for us, the highest rates of obesity. So I think our communities are suffering from things like kind of like what the Reverend was saying, things that were done to us beforehand. So we have to get together because we are more at risk just from the zip codes that we live in. So that's why I think it's super important, like what the Reverend was saying, like, let's all get together, forget about your size. Let's get together. Let's get focused on what we need. And that's why in Baltimore, you have such huge impacts. And I have to say the same thing about Elmhurst, when we literally focused on making sure that the people that were getting access to the vaccine were people from our community was key. Making that small policy change was important at the beginning, because we were having people coming from like all over the place, but from our 7 neighborhoods, and we said, no, our patients come first. And when you're serving 1.2 million people, that's a huge impact. And that's a huge impact in trying to stop to spread the disease of flu, of COVID, of obesity, all the work that we do, it's super important. And, sadly, social determinants is something that we're going to have to work on together. And it's going to take time.
So that's an excellent, I'm afraid we have to end. We're at the end of our time. We have so many questions. I'm going to share the email address.
Yes.
That I put up earlier. Let me see here. I would welcome anyone sending your questions to this address, and we would be glad to provide answers from the folks on this panel. And I know there's questions about age distribution of risk in Black and brown populations, as well as co-administration of vaccines. There's a lot of questions about turning our voices towards advocacy and inclusion, and to combat bias, including implicit bias. I'm just giving you a sense of the topics covered, and how people who are at grave risk with disabilities and chronic illnesses, when's it going to get back to normal for them? So are we at the end of our time? Let me ask the moderator. We are. So I wish we had 2 more hours and we could be there right with you and talk through all of this. But I want all of you to kind of join us, use these tools, become that light, become part of our communities. And we're just going to make this happen. Thank you, every panelist. You are amazing.
You're welcome.
Thank you for
thank you.
The opportunity.
Thanks, Black Health Matters.
Bye.
Take care.